Medicare 101. This presentation is for educational purposes only. We will be going through what is Medicare, what are Medicare Advantage plans, what are Medicare supplement plans, the prescription drug benefit of Medicare, and then we'll briefly touch on dental. This is just a little bit of information about myself. I graduated from Washburn in 1979 and have been in the insurance business for 43 years. A little history about Medicare. Medicare was signed into law in 1965 by President Johnson. Medicare is health insurance, and that's all it is. It has nothing to do with Social Security payout or pension benefits. It is health insurance for those people age 65 and over, or for those people who are under age 65 and is on Social Security disability, and at some point they have become eligible for Medicare. Medicare consists of 4 parts. We will be going over each one: A, B, C, and D. When is the initial enrollment period for Medicare? People turning 65 or older, there is a 7-month period that begins 3 months before the month the person turns 65, includes the month of the 65th birthday, and then 3 months after. If you sign up for parts A and B during the first 3 months of your initial enrollment period, your coverage start date will depend on your birthday. If your birth date is not on the first day of the month, your Part B coverage will start the first day of your birthday month. So, an example, you were born on July the 4th. The start date would be July 1st. You were born on July the 30th. Your start date will be July the 1st. Now, if your birthday is on the first day of the month, then your coverage will start the first day of the prior month. So, if you were born on July 1st, your start date would be June 1. Now, if you sign up for parts A and B during the last 3 months or the month that you turn 65, your start date will be delayed. Now, the majority of the people sign up during that first 3 months. And I think what contributes to that is that people are bombarded with literature starting 1 year before their 65th birthday. So this does prompt them to enroll. Example, if you wait until the 3rd month after you turn 65 or the 7th month, then you will have a 3-month delay after your enrollment. Now, once a year there is a general enrollment period. This is for people who may have missed their initial enrollment. The period is from January the 1st to March 31st. Your coverage will begin July the 1st, and you may have a higher premium. I used to refer to people and say these were people that were asleep at the wheel. This gives them an opportunity to enroll between January 1 and March 31st. Now, the special enrollment period, Medicare coverage will begin the month after Social Security gets your completed request. Usually you do not pay a Part B late enrollment penalty if you sign up during this special enrollment period. Now let's put this into an everyday scenario. let's say that I am turning 65, but I'm going to continue to work and stay on my employer's group health plan. It has been determined it is better for me to stay on the health plan than it is to go on Medicare. I can not enroll into Medicare, and then once I leave that employer or leave that plan, then this will be considered a special enrollment period. Then I can sign up for Medicare at that time. People who are 65 and older need to sign up for A and B one of two ways. They can either go online and sign up through the Social Security website, or they can call their local Social Security office and be enrolled. If a person is taking Social Security and or railroad retirement, then they will automatically be enrolled into Medicare. This is what the Medicare card will look like. We often refer to it as the red, white, and blue card. It will have the participant's name and their Medicare number. In the past, it has been the Social Security number with a letter behind it. Now, it will be random letters and numbers. On the card, it will state when Part A went into effect and when Part B. So what is Part A of Medicare? Think of it as inpatient care. A person is admitted to the hospital. Skilled nursing facility care. Example would be coming out of the hospital and not well enough to go back to their home, so they go to a skilled nursing facility. Hospice, home health care is included in Part A. Inpatient and outpatient rehabilitation services after a qualified inpatient stay. Now, Part A has a deductible to it. We all know what a deductible is. It's a charge that you have to pay before the insurance starts paying. This year, the deductible is $1,556 per benefit period. Now, if a person has paid taxes for at least 10 years or 40 quarters throughout their working life, then Part A does not cost anything at this time, because basically it has been prepaid. An example would be when a person gets their paycheck, and on their paycheck it shows a deduction for FICA. That is prepaying Part A of Medicare. So A is hospital. Part B of Medicare, think of it as any other service you could get with the exception of outpatient drugs. This is your primary care visits. This is when your primary care physician refers you to a cardiologist or another specialty doctor. Outpatient care, think of it as X-ray and lab. The emergency room. Observation care while in the hospital and not an inpatient. It could be your urgent care centers. Durable medical equipment is covered underneath Part B. Durable medical equipment could be things like CPAP machines, insulin pumps, pacemakers. Part B has some preventive services included as well. Now, Part B has its own deductible. This is a calendar year deductible. A person would satisfy this, and then after, Medicare would pay 80% of what they would approve, and the participant, the beneficiary, would pay 20%. There is no cap on that 20%. This year, the deductible is $233. Now, a person has not prepaid for the premium for Part B. So based off your income and going a 2-year look back, if a person that was filing an individual tax return makes less than $91,000 a year, or if a joint tax return filer makes less than $182,000, the premium for 2022 is $170.10 a month per person. Now, every November, the federal government will come out and release what the deductible and what the premium is going to be for the next year. This deductible and premium is based off from several factors, like the cost of living adjustment on Social Security. Now, what isn't covered by Medicare? Here are 6 items that over the years people thought they had coverage for that Medicare does not cover. Long-term care or custodial care. This is where you move to a long-term care facility. This is your new residence. Medicare does not cover it. That's why people have long-term care insurance. Routine dental or eye care is not covered. Dentures, anything elective surgeries, not covered. Routine foot care and hearing aids and exams. Again, these are 6 items that people over the years have thought they have had coverage for that Medicare does not cover. We'll move on into Medicare supplement or Medigap policies. What are supplements? Supplements help pay for the costs that Medicare approves but does not pay. And the key word is approves. If Medicare does not approve the charge, then a supplement will not pay anything. Medicare supplements are standardized by the federal government. There were 10 policies or supplements available to people to purchase up until January 1 of 2020, and now there are 8. It does not matter what insurance company you choose the policy from. If you choose a supplement that is a Plan G, then a G is a G is a G. The coverage is all the same. Doctors, hospitals, providers do not care what company a person has on a supplement because they will bill Medicare. Medicare will then file the claim with the supplement carrier, and then the supplement carrier and Medicare will pay if it's an approved charge. Again, it does not matter what company you choose. You must have Parts A and B to enroll into a supplement. You will pay an extra premium in addition to your Part B premium to have the supplement. Prescription drug coverage is not included into supplements. That's why people go and buy a drug plan through Part D. Now let me stop here a moment. If you have a medication that you can only receive by an infusion or injection in a clinic setting, then those are more than likely covered through Original Medicare Part B. Now this is the chart that showed the original 10 plans. Up until 1/1 of 2020, a person could choose from any of those. But after 1/1 of 2020, the federal government says for those people who are initially coming into Medicare, then a Plan C and a Plan F will not be available. So let's draw our attention to Plan G. How you read this chart is Plan G will pay 100% of whatever Medicare approves but does not pay, with the exception of one item, and that is the Part B deductible. So if we can remember what that is for 2022, that's $233. That is your only expenditure as long as Medicare approves the charge. So if you stay on traditional Medicare, A and B, and you pick up a supplement, then you can go to any doctor, any hospital that accepts Medicare anywhere in the United States, and whatever Medicare approves but does not pay, with the exception in this case of $233, is paid by your supplement. Now, if there are Medigap or Medicare supplement plans that have the term behind them select, then you may have to use certain providers and certain hospitals on a non-emergency basis. Now, when do people enroll into a supplement? Usually when they first obtain Parts A and B of Medicare. There is a one-time 6-month open enrollment period. A person could have multiple health concerns, and an insurance company cannot decline them for coverage during that first 6 months. After that 6 months, if a person wants to move or apply to a different company, maybe because the premiums are lower, then they would have to go through a medical underwriting process. They would complete a health history questionnaire, and the company would not be required to offer them insurance. Some of the conditions that we are seeing, that if you're after that 6 months and apply for a new policy with a different company, that most of these companies would not insure you, is maybe insulin-dependent diabetes. We're looking at rheumatoid arthritis, Crohn's disease. These are 3 items that we see that the majority of the insurance companies will not offer an insurance policy if you have to go through medical underwriting. Now, 3 ways that an insurance company comes up with their rates. There's a community rate system, which means that everybody pays the same rate regardless of the age. A 65-year-old would pay the same as a 95-year-old. The 95-year-olds would love it. The 65-year-olds have a tendency to hate it because they feel that they're subsidizing the 95-year-olds. An issue age policy means the premium is based on the age at the time you entered the plan. So if you enter the plan at age 65, you will always pay what they're charging for a current 65-year-old, no matter how old you get. So at age 68, at age 72, at 84, at 93. If you went in at 65, you would still be paying a current 65-year-old rate. Now, each year, the insurance companies submit to the Department of Insurance how much premium they brought in and how much claim they paid out, and then they ask for an adjustment. We used to say an increase, now we say adjustment. The insurance department can say yes, that company can take, for example, a 10% rate increase. The department can say no, you can only have a 5%, or the department can say you can't have a rate increase at all. So these companies can't arbitrarily come out here and just raise your rate because maybe your expenditures, your claims were high. Now on an issue age policy, you would still get that medical increase if one was awarded each year, but you would still be tagged as, in this case, a 65-year-old age band, if that's the age you went into it at. Now, an attained age policy, not only will you get the premium increase if awarded by the state each year, but the premium will increase each year based on your current age at that time. So when you're 68, you're going to be paying a current 68-year-old rate. At age 70, you're going to pay a 70-year-old rate. When you're 84, you're going to be paying a current 84-year-old rate. Part D, prescription drugs. There are two ways to get drug coverage through Medicare. You can get it as a standalone drug card or through a Medicare Advantage plan or a retiree group plan. When do you join, switch, or drop a Part D plan? There's that 7-month period again. If you're under age 65 and on Medicare disability. Now there is an annual enrollment period. Every year between October 15th and December 7th, a person can evaluate the plan they're on this year. They can look at the plans that are available for the next year, and they can determine if they'd like to switch. There is also a special enrollment period. These drug plans are based off from zip code. So if you live in one zip code and you move maybe a state over and change your zip codes, then the plan you're on now might not be available where you're moving to, and you'll have to change plans. 5-star special enrollment period. Medicare will rate these plans and give them a star rating, 1 to 5 star. Now, we have never seen a plan that has been awarded 5-star. And what goes into a star on the star rating? It could be everything. It could be the formulary list of the drug plan. It could be how many pharmacies participate. It could be customer service surveys. Everything goes into a star rating. Now, if throughout the year, if a plan were to be awarded a 5-star, then you would not have to wait until open enrollment to move to that plan. You could do so during that year. Now, what are the drugs going to cost on these plans? Well, it's all going to determine on which plan you choose. It can depend on where the drug falls in the formulary list of that plan. Is it a tier 1, tier 2, 3, 4, 5? It will also depend on which pharmacy you choose. These plans will have preferred pharmacies and standard pharmacies. The plan also may include a list of pharmacies that they don't include at all. So every year when you look at these from October 15th to December 7th, pay close attention on, is your pharmacy still in the network if you stay with the same plan? Is the drug that you've been taking, is it still a tier 1 or did it move to a 2 or was it a 4 and it moved to a 3? These are the types of things you'll want to look at every year. There will be an extra premium to have this Part D coverage of Medicare. Let's say you get your drugs card and you're going to your pharmacist and you're receiving your drugs, and then one day the pharmacist tells you that you have now entered the coverage gap or the donut hole. What is that? The federal government will allow these plans this year to charge up to a $480 deductible, and then after that you would make a copay or co-insurance. Once what the insurance company has paid out and what you have paid out, if it reaches $4,430, then now you enter the coverage gap or the donut hole. Once you've entered this, you will start paying 25% of the cost of both name brand and covered generic drugs. That's when you go into the catastrophic coverage phase. At this point, you will pay a small percentage of 5% of the retail cost if it is greater than $3.95 for generic or $9.85 for brand name. Now, a Part D penalty. To have prescription drug coverage is not required by the federal government. But if you go more than 63 days without credible coverage and then you want to elect Part D coverage, then a 1% of the national base beneficiary premium will be imposed. This year, the national base beneficiary premium, or the average premium for a drug card across the United States, is $33.37. 1% of that would be about 33 cents. You would pay that 33 cents times the number of months that you were without coverage, and this penalty will be forever. So in this example, it shows that we have a fictitious person by the name of Mrs. Smith that was eligible to enroll into Medicare Part D 12/1 of 2020. Now in this case, Mrs. Smith would say, hey, I've done everything right. I've ate my fruits and my vegetables, and I've ate turkey and chicken instead of rib steaks. Heck, I've worn out 2 Fitbits in the last 3 years. I'm only on a low dosage aspirin, so why do I need a drug plan? So she did not purchase one. Now around June or July of the next year, she goes in for an annual physical, and something just doesn't sound right, so she's referred to a cardiologist. As an end result, it is determined that Mrs. Smith may have AFib and is placed on a medication. So now Mrs. Smith comes back and wants to enroll in a Part D. She cannot. She has to wait until the open enrollment period, October 15th to December 7th, with a January 1 effective date. So in this case, Mrs. Smith would have been without coverage for 13 months. So 13 months times basically 33 cents would equate to around $4.40 extra each month that she would have to pay. Now, this is in addition to her Part D premium. So if her Part D premium on the drug card is $10, it's going to cost her $14.40. Now, this penalty is for life. Now, it can change each year because the national average can change on the premium, but the penalty is there for life. So if you stay on traditional Medicare, you would have Medicare A and B. You would choose a Medicare supplement, and then you would choose a Part D drug card. So what is Part C of Medicare? Part C is Medicare Advantage plans. Medicare Advantage plans, they're medical plans offered by private insurance companies. They must include all the benefits and services covered by A and B of Medicare. So a Medicare Advantage plan can come out and say, for example, we're not going to cover that rotocuff repair if traditional Medicare would have paid for it. Most of these plans generally include prescription drug benefits, so a person does not need to go out and buy a separate drug card. You see these plans have extra benefits like dental and vision, gym memberships, maybe rides to and from the doctor's office. How can an insurance company do this? What has happened is Medicare has basically outsourced itself to an insurance company. Medicare can come in and offer insurance companies, if they create a health plan and Medicare approves it, for every person that companies sign up on their health plan that Medicare is off the hook for claims, then Medicare will pay that insurance company a price per head per month. To keep it simple, Medicare may give an insurance company $1,000 per head per month. The insurance company will look back and say, if we get $12,000 a year, now this is example purposes only, if we get $12,000 a year and there's 30,000 eligible beneficiaries, and if we can pick up 1% of those people enrolling in our plan, so 300 people, we can pay all the claims, we can make 1 or 2% profit off from it, we can throw extra things in there like dental and vision and gym memberships, and we may have some money left over, and we can pass this back on to the customer in the form of, we see a lot of zero premium. That's how they come up with this. These are yearly contracts. Now, when do you join or leave a plan? Well, again, when you're aging in, if you're under 65 on disability, there's that open enrollment period, October 15th to December 7th. There's that special enrollment period when you move out of the area. So again, if you're in one zip code and you move to another one, that plan that you're on might not be available in that new zip code. There's that 5-star special enrollment period again. Now, every year between January the 1st and March 31st, they have a Medicare Advantage open enrollment period, which means that if you're on one Medicare Advantage plan and then you decide during the first quarter that you really wanted to go with a different company or a different plan, you can do that. You can go from one Medicare Advantage to another Medicare Advantage if offered in your area. Or between January 1 and March 31st, you can go back and have Medicare, original Medicare, be your insurance. Now, going through all this, you never disenroll out of Medicare. You're always enrolled, so you're always paying that Part B premium for Medicare. But between January 1 and March 31st, you can say, I really didn't want to be in a Medicare Advantage plan. You can go back and have Medicare be your insurance. Now, the only issue with this is, after the first 12 months of being on a Medicare Advantage plan, if you wanted to go back to original Medicare as primary and you want to pick up a Medicare supplement and nothing else has changed, you will have to go through that medical underwriting process, and a company does not have to offer you a supplement. Now, what are you going to pay on an Advantage plan? Again, there may be a monthly premium. There may be a deductible. There will be co-pays and co-insurance. There will be a network of doctors and hospitals and providers. So you would have a liability up until you reached a certain amount out of pocket for in-network and a certain amount of pocket out of network. Once you meet these yearly limits, then you can pay nothing. Kind of sounds like group insurance. Now, the prescription drug coverage in most cases are included in these plans. If they are, then they will follow the same rules that a standalone Part D would have. So it would have your initial period, it would have your coverage cap, and it would have your catastrophic phase. There are some Medicare Advantage plans that do not include drug coverage. Most of the time, these are designed for veterans that have the VA prescription drugs available to them. So when a person becomes Medicare eligible, there are two ways that they can go. They can go traditional Medicare, have Part A and B, pick up a drug coverage, Part D, and a supplement. Or if there's a Medicare Advantage plan that's available in their area, they can determine if that plan, if they want one that has prescription drug coverage included, and they can enroll in that. Now, Medicare, again, does not include dental. Some Medicare Advantage plans may offer dental coverage. There are standalone dental plans available for people over the age of 65. So this has been a brief but hopefully educational 40 minutes. The basics of Medicare A, B, C, and D.